Well, the main hospital in the Sudanese city of el-Fasher has been attacked and it's now out of service, according to Doctors Without Borders. Staff have been forced to transfer patients after the rapid support forces opened fire inside the facility on Saturday. It was one of the last medical facilities still operating in el-Fasher that's home to more than 1 million people. About 130,000 people have fled their homes in a month to escape the fighting. The UN says the number of internally displaced people in war-torn Sudan has now reached over 10 million. Michel, Lacharité is head of emergency operations at Doctors Without Borders. He's joining us live now from Paris. Thank you very much indeed for being with us. I cannot imagine that closing a hospital during the middle of a humanitarian crisis is an easy decision to take. Why was it done?
In fact, the city of el-Fasher in Darfur is now facing 1 month of fighting between rapid support forces, joint forces, and supported by the Sudanese army. This violence and impact on hospital is not new. This same hospital of South Hospital, I've seen shrapnel, stray bullets, 2 people killed in the hospital in the past months. But now what we have seen, seeing the rapid support forces entering the hospital, shooting, looting the pharmacy, looting the administrative office, looting one of MSF ambulances is really outrageous, and really a line has been crossed.
In terms of getting the patients out, how much notice did you have and how many people were you able to get out of the hospital before things became particularly bad and you were forced to close it?
Yes, during the past week, along with the Ministry of Health, we started to evacuate some patients because the offensive coming by the eastern part of the city of el-Fasher, so we anticipated a bit. Some of them were referred to Saudi hospital and some just flee the hospital. So when we were forced to close and to stop the activity hospital. This is the second hospital because 1 month ago the pediatrics hospital as well on the eastern part of the city were closed just after the Sudanese armed force shell in front of the hospital and the impact on the hospital, we needed to close it. So this is the second hospital within a month and in a city where the access to healthcare is complicated and in the camp full of internally displaced people in the south of the city as well is struggling with a huge problem to access to food with a skyrocketing malnutrition rate that we're witnessing. So MSF, we ask for the protection of civilians, including the health worker, and the protection of the hospital, and of course to have a safe access to support and to supply the city of el-Fasher and the camp of Zamzam in the south of the city.
You said you were looking for protection for civilians and medical staff and so on. Given the fact that, if I understand you correctly, the attacks on medical facilities where you are have come from both the rapid support forces and the military, the armed forces as well, who do you think is going to provide that protection?
In fact, the consequences of the fight, it's quite complicated to understand what happened in the past month. We have seen shelling from the Sudanese army. We have seen attack as well from the RSF. What is very new on Saturday, this is the rapid support forces entering the hospital and shooting inside the hospital. So this is really a new component, but both warring parties, or the 3 warring parties with the SAF, joint forces and rapid support forces, they need and must respect hospitals and protect the civilians.
If the target or the intention behind this attack by the RSF has been to take medical supplies, to take equipment and so on, what are your concerns for the remaining medical facilities, the few that there are for the area, particularly those that you mentioned before, the ones that are dealing with those, I would imagine, thousands, at least thousands of displaced people who are in the camp to the south of the city?
Yeah, we need to imagine that the people in the city of el-Fasher, they feel unsafe and they can't escape from the city. Médecins Sans Frontières, we succeed to evacuate our international staff at the end of May. However, we still have 200 staff working in el-Fasher. We are really concerned. We are trying to see or seek any place to re-establish or to build any surgical capacity, but we are kind of desperate. We really need to find a safe area. That's why we call for the protection of the hospitals.
Michel Lacharité is Head of Emergency Operations at Doctors Without Borders. Thank you very much indeed.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.